Welcome to Warriors Inspiration, the number one channel for sickle cell motivation.
Okay, welcome back to Warriors Inspiration. Today we're doing short interview about sickle cell awareness. What people know about sickle cell. Thank you. So, sir, what's your name?
Yes, I'm Mr. Daniel.
Okay, sir. Thank you very much.
Yes, you
Let's ask some questions about sickle cell.
Okay.
Do you know what sickle cell disease is?
Actually, I don't know much about sickle cell.
Okay. Sickle cell disease is an inherited disorder, blood disorder,
Okay.
whereby the child inherits an S genotype from the mother and an S genotype from the father. So, when these two S genotypes are inherited, the person now has an SS genotype, which is the sickle cell disease genotype. You understand? So, that's how it can be gotten, and that's what it is all about. It's a blood disorder whereby the red blood cells are not in the normal shape; they are sickled. So, they they are they are prone to blocking the blood vessels and causing pain.
Okay.
So, sir, do you think sickle cell disease is spiritual?
Okay, from your explanation, I think it's both spiritual and it's something that can be inherited. It's spiritual.
Okay.
Yes.
It's not spiritual, sir. It's medical.
Yeah.
Yes, it's medical. People think it's spiritual, but it is not spiritual. It's so totally medical. When the genotype is something that is medical. A gene. You know what a gene is?
Yeah.
Yes. When a gene is inherited from the father and from the mother, this inheritance is a medical inheritance through fertilization. It is inherited, and then the child comes down with sickle cell genotype. Yes, sir. Thank you for that.
All right.
Is sickle cell disease communicable? Do you think it's communicable?
Yes.
Help us,
Okay. What are communicable
help
diseases?
us. There is God.
Communicable diseases are those diseases that can, be communicated through air.
Okay, like COVID-19.
COVID-19,
Sickle cell disease is not communicable.
Okay.
By touching the person, by hugging the person, kissing the person, you cannot catch sickle cell disease. It is inherited from the gene.
From the gene.
So, except by birth,
Okay.
if the father has the S genotype, the mother has the S genotype, the both of them now have yes,
sickle cell.
yeah, the child will now have sickle cell.
Okay.
So that is the only way it's transmitted.
Okay.
Okay, so how can sickle cell disease be prevented? With what I've told you so far.
Yeah, it can be prevented through medical treatment.
In what way?
And by regular checkup.
Okay.
Um,
You're far from the truth, but you're almost there.
Okay.
Sickle cell can be prevented by doing a genotype test. There's a test called the genotype test. Before you get married, you're supposed to carry your wife or your spouse to the hospital and do a genotype test. That genotype test will tell you whether you are AS, you are AA, you are SS. So if you are SS and your wife is SS, you're not supposed to get married because a child can come down with sickle cell disease when the two S genotypes match. So only AA, people with AA can marry any person with any genotype because AA doesn't have an S in it. AA genotype can marry SS, AA genotype can marry AS, and they will not come down with sickle cell disease. Do you understand? Thank you very much.
You're welcome.
So, I guess you have not heard of crisis pain before.
Crisis pain.
Yeah, crisis pain.
Mhm.
Have you heard of crisis pain?
No.
Okay. Because a child is born with sickle cell, the red blood cell, like I said, is sickled. When they pass through the blood vessels, they tend to clump together and occlude the blood from flowing, and then they cause pain. Crisis pain is the pain experienced by sickle cell patients. It's an excruciating pain in their joints, in their bones, and that pain can last for hours if not treated. Most times they have to treat by giving blood transfusion, that is an AA blood to the sickle cell patient, so that the blood can flow without having crisis. So the only way you can treat crisis pain is either through giving pain medication or blood transfusion. And I'm sure you don't know what to do if someone has sickle cell.
you know.
Okay. What you do is give them pain relievers, like I said. If you have pain relievers, give. But if you don't have pain relievers, send the person to the nearest hospital. The doctors there will know what to do. If you tell them that this person is an SS patient, sickle cell patient. So can women with sickle cell disease give birth?
Yes.
Okay, that's good. They
Can
can
give birth.
they can give birth. As long as they marry a man that is AA, women with sickle cell disease can give birth. If they are given the proper medical attention, they can give birth. So do you know, I'm sure you know this one, but try. What is the cure for sickle cell disease? What I've said so far.
Yes, one of the cure for sickle cell disease, like you rightly explained, is you know you run the genotype test.
Okay. Okay.
And to be sure if actually you are sickle cell
Yes.
patient.
Yes.
So when that test is conducted, then you can go for further.
Okay. So the cure for sickle cell disease is something called stem cell transplant or bone marrow transplant. The person that has an AA genotype that is not sickle cell would take his stem cell and his bone marrow and be transplanted into someone that is sickle cell so that it can replace the blood forming agents in that person. Do you understand? So that is how to cure the person. Thank you for your time, sir.
All right, you're welcome.
God bless you, sir.
Thank you so much.
But
Okay, that's the